If you've been referred for a colonoscopy, then you've been referred for an examination of the large intestine by a colonoscope. This involves taking a very special bowel preparation coupled with a diet prior to the procedure, because it's very important that the bowel is washed completely clear so we get very good views all the way around the large intestine. We often also pass the camera into the small intestine as well. So that's very important, and taking the bowel preparation can be quite tiring, quite dehydrating. So if you have any concerns about taking a bowel preparation, please bring that to the notice of our staff before you take the bowel preparation. Sometimes we admit patients the night before to hospital so we can have them rehydrated and chaperoned for that bowel preparation. It's very important when you present for the colonoscopy as a day case that you have a chaperone. You cannot drive your car or undertake any special, sign any special legal documentation on that day. It's also very important that you wear nice, comfortable clothing. It's critical that you know your medications, and it's critical that you know your medical history prior to presentation. We want to know if you're diabetic. We want to know if you have heart or respiratory issues before you come in for the procedure. And there are some medications that we may well stop before you have the procedure, such as the diabetic medications, insulin, oral hypoglycemic agents, for example, and blood thinners, anticoagulants, which may be aspirin, warfarin, or other newer-acting anticoagulation. Very important that you tell us about this before you come in. You'll be seen by a pre-admission nurse who will take a very detailed history, and also an anaesthetist before you're wheeled into the endoscopy theatre. You'll be placed on a nice, comfortable endoscopy couch, examination couch, and the anaesthetist will apply a very small needle into one of the venous channels in your arm, through which drugs will be administered, and you'll fall to a beautiful sleep. You won't feel any part of the procedure. During the procedure, the gastroenterologist will be passing a flexible telescope called the colonoscope all the way around the bowel, from the rectum, through the transverse colon, into the right colon, right down to the cecum, and then off and back also into the small intestine. We examine the entire large bowel because abnormalities, pathologies can be found throughout. In particular, if you've been bleeding from the rectum, we may find hemorrhoids, we may find polyps, lumps of tissue growing inside the bowel, and it's very important we look for those because they can be precancerous, and we make every attempt to remove polyps. We may find a condition called diverticulosis, which is where little outpouchings occur in the bowel wall. This is a very common condition. We may find inflammations of the bowel, so-called inflammatory bowel disease, and there are several different forms of this. Ulcerative colitis is one form, and Crohn's disease is another form. These are all the things that we do. During the procedure, we often will take tissue samples. This is called a biopsy. The procedure may take 15 to 20 minutes. You're monitored very carefully during the procedure. All your vitals are being assessed. We're assessing your oxygen levels, we're assessing your blood pressure and your pulse. So you're kept very safe for the whole procedure. When the procedure is complete, we roll the trolley out into the first stage recovery, where you'll be pampered by some very beautiful nursing staff.